Hello, everybody. I'm Mike Anderson, a local insurance agent right here in East Tennessee. You know, Medicare can be very confusing. And if you're turning 65 soon, you might be right in the middle of taking a serious look at your Medicare options. What are those options? Let's take a real good look.
Medicare, making the choice that's right for you. You have many options to consider when choosing your Medicare coverage, and what's right for you may not be right for your friend, Bill down the street in the neighborhood, or even your spouse. You need to consider the options and choose the option that best suits your needs. Today we're going to cover some facts about Medicare. We're going to talk about your Medicare options, some costs, and important dates and more. I want you to feel very confident when choosing your Medicare coverage. So, what is Medicare? Well, Medicare is the largest health insurance program offered by the U.S. government, serving more than 55 million people. It was started back in 1965 under the Johnson administration, and it was created for people ages 65 and over, regardless of income, medical history, or health status. The program was expanded in 1972 to cover people under age 65 with permanent disabilities. And today, Medicare plays a key role in providing health and financial security to older people and younger people with disabilities. It's run by the Centers for Medicare and Medicaid Services, or as I like to call it, CMS for short, part of the U.S. Department of Health and Human Services. Medicare is divided into parts. Parts A and B are original Medicare. Part C is Medicare Advantage, and Part D is prescription drug coverage. So who's eligible for Medicare? Well, at age 65, you're eligible for Parts A and B, even if you still work. You may be eligible for Medicare through your spouse, although you must still qualify by age or disability. You may also qualify for Medicare Parts A and B if you're under 65 and have a disability. It's important to note here that once you're on disability for 24 consecutive months, you automatically qualify for Medicare. Original Medicare, it's offered by the federal government. Part A helps cover the hospital, skilled nursing facility, hospice, home health. Part B helps cover doctor appointments, outpatient care, occupational and physical therapies. Medicare offered by private companies, or Part C, helps cover everything that Medicare Parts A and B covers, often covers additional services like dental, vision, and wellness programs. Part D helps cover prescription drugs. Your Medicare options. Most folks get their Medicare coverage in one of two ways. Original Medicare, which I like to call red, white, and blue Medicare, Part A and Part B, along with a standalone prescription drug plan offered from a private company, and a Medicare supplement insurance plan from a private company, or a Medicare Advantage plan from an insurance company, which includes Part A and Part B. These plans often include extra benefits and services at no extra cost, often include prescription drug coverage as part of the plan, and often you will have to pay the Part B premium in addition to the Medicare Advantage plan premium. The initial enrollment period. So when can you sign up for a Medicare plan? Well, in the 3 months prior to turning 65, the month in which you turn 65, and the 3 months after turning 65. So the way I remember that is like this. You can sign up for a Medicare plan 3 months before, the month of, or 3 months after you turn 65. So 3 months before, the month of, or 3 months after you turn 65, you can sign up for a Medicare plan. If you retire after 65, enrollment depends upon when your employer-sponsored coverage ends, and also newly qualified due to disability. Important dates to remember: October the 15th through December 7th. Well, that's the annual election period for Medicare Advantage plans and prescription drug plans for the next calendar year. January the 1st through February the 14th is the annual disenrollment period if you're choosing to return to original Medicare, and you also can get a window of opportunity to choose a standalone prescription drug plan during that period of time. Generally, you can only make changes to your plan due to special conditions like moving out of your plan area or having Medicaid coverage. Choosing what's right for you. There are options to consider. The cost, of course, is a concern. How much will you pay for premiums, deductibles, coinsurance, and copayments? Benefits. Are additional benefits included, such as prescription drug coverage? Convenience. Are the plan providers conveniently located? Think about your needs, about your healthcare history. Do you have a chronic condition? Will your healthcare needs grow in the near future? Your prescription drugs. If your prescription drug spending increases in the future, Medicare Part D may help cover the cost. Need more coverage than Medicare Part A and Part B? A Medicare supplement or Medicare Advantage plan may help cover some unexpected healthcare costs. What to know when considering Medicare Advantage instead of staying with original Medicare? You must have both Medicare Parts A and B coverage. You usually will have to pay an additional monthly plan premium. You remain a member of the Medicare program as long as you continue to pay your Part B premium if applicable. So, if you join a Medicare Advantage plan, you do not lose your Medicare. Let me say that again. If you join a Medicare Advantage plan, you do not lose your Medicare. You may have the option of paying an additional premium for optional supplemental benefits like dental and vision. Types of Medicare Advantage plans. There are HMOs, or health maintenance organizations. That's where a primary care physician arranges your health care within the plan's network. There are PPOs, preferred provider organizations, where you can choose any provider that accepts Medicare, but you'll probably pay less for in-network services. Private fee-for-service plans, more freedom to choose providers, but a network arrangement may still apply. Special needs plans, tailored for those who may have a chronic illness, such as diabetes or a heart condition, or for those who are eligible for Medicare and also receive Medicaid assistance from the state. Some Medicare Advantage extra benefits. Medicare Advantage plans usually include extra benefits and services which may reduce out-of-pocket costs. For example, some Medicare Advantage plans include fitness programs, vision and dental coverage, mail delivery, pharmacy access, health education programs, and also nurse advice hotlines. Special needs plans. Medicare Advantage special needs plans generally offer benefits, providers, and drug lists which are designed to meet specific needs. To join a Medicare-approved special needs plan, you must have Medicare Parts A and B and at least one of the following: have a chronic illness like diabetes or a heart condition, or be eligible for Medicare and receive Medicaid assistance from the state. Special needs plans include all Medicare Part A, B, and Part D benefits. Medicare supplement plans. These plans are often called Medigap plans, and they're plans that work with original Medicare. They're designed to cover some of the costs not covered by original Medicare. Each Medicare supplement plan has a unique blend of benefits. Medicare beneficiaries may want to select this type of plan because costs can be more predictable and they are not limited to a specific network of providers. Medicare Part D, or prescription drug coverage. Part D coverage is available only from private companies contracted by the federal government. Part D plans are required by federal law to offer the basic benefits offered by Medicare. You usually choose Part D in one of two ways: a standalone insurance plan you buy to cover medicines, or a PDP plan as part of a Medicare Advantage plan that includes Part D or Medicare Advantage prescription drug plan. If you enroll in a Medicare Advantage plan with prescription drug coverage, you don't need to sign up for a standalone prescription drug plan. The coverage gap. The coverage gap, also known as the donut hole, is a phase of Part D coverage when you pay a higher percentage of your prescription drug costs. You move in and out of the coverage gap when your total costs reach a specific dollar amount. These amounts are adjusted annually by CMS. Other helpful resources are available at Medicare.gov, the Medicare and You Handbook, which is published by the Centers for Medicare and Medicaid Services and released each fall, Choosing a Medigap Policy, a guide to health insurance for people with Medicare, a publication developed jointly by CMS and the National Association of Insurance Commissioners. Other helpful resources, shiptalk.org. Go there to view your local state health insurance program, or SHIP for short. You may be also eligible to get extra help to pay for your prescription drug premiums and cost. To see if you qualify, contact your state Medicaid office or the Social Security Administration.
If you have questions about your Medicare options, I'm here to help. My contact information is right there at the bottom of the screen. I look forward to hearing from you soon. Thanks so much for watching, and be sure to like us on Facebook. Bye now.